Hello, and welcome. Today, we're diving into a common ear condition, tympanic membrane perforation, more commonly known as a perforated eardrum. We'll explore what causes it, how it affects your hearing, and what can be done to treat it. So, what causes a hole in the eardrum? The most frequent culprit is infection, specifically middle ear infections. When pressure builds up from fluid and pus, it can rupture the eardrum. Other common causes include trauma, such as a direct blow to the ear, sudden changes in air pressure like during flying or scuba diving, inserting objects too far into the ear canal like cotton swabs, or even a loud noise like an explosion. In rare cases, it can be caused by the insertion of foreign objects into the ear or skull base fractures. Let's break down what happens. The tympanic membrane, or eardrum, is a thin, cone-shaped membrane that separates the outer ear from the middle ear. It vibrates when sound waves hit it, transferring these vibrations to the tiny bones in the middle ear. A perforation disrupts this process. The hole alters the way the eardrum vibrates, leading to a temporary hearing loss. Additionally, a perforation makes the middle ear more vulnerable to infection because it removes the barrier that protects the middle ear space from the external environment. Tympanic membrane perforations are fairly common, affecting people of all ages. Children are particularly susceptible due to their higher risk of ear infections. Studies suggest that a significant percentage of the population will experience at least one episode of acute otitis media, a common cause of perforation during childhood. Adults who participate in activities like flying or scuba diving without proper precautions, or who work in environments with loud noises are also at increased risk. The symptoms can vary depending on the size and cause of the perforation. Some people experience immediate sharp pain, while others may only notice a gradual decrease in hearing. Common symptoms include ear pain, which can range from mild to severe, drainage from the ear, which may be clear, bloody, or pus-filled, tinnitus, or ringing in the ear, and vertigo, or a sensation of dizziness. Hearing loss is almost always present, but its severity depends on the size and location of the hole. Diagnosis is usually straightforward. An otoscope, a lighted instrument used to examine the ear canal, allows a doctor to visualize the perforation directly. An audiogram, a hearing test, will assess the extent of any hearing loss. In some cases, a tympanogram, which measures the movement of the eardrum, may be used to help confirm the diagnosis and evaluate middle ear function. Further, a tuning fork test helps the healthcare professional determine the nature of hearing loss, whether it is sensorineural or conductive hearing loss. While there aren't specific sub-types of perforations, they can be categorized based on size, location, and cause. Small perforations often heal spontaneously, while larger ones may require intervention. Perforations located in the central part of the eardrum generally heal better than those at the edges. Traumatic perforations from sudden pressure changes are more likely to heal quickly than those caused by chronic infections. Treatment depends on the size and severity of the perforation. Many small perforations heal on their own within a few weeks or months. In the meantime, protecting the ear from water and infection is crucial. Antibiotics may be prescribed to treat any existing infection. If the perforation doesn't heal spontaneously, a procedure called myringoplasty may be recommended. This involves patching or grafting the eardrum. In some cases, a paper patch or fat graft may be used to cover the perforation. More complex cases may require surgical reconstruction with tissue grafts. Preventing tympanic membrane perforations involves addressing the underlying causes. Prompt treatment of ear infections is key. Avoid inserting objects into the ear canal. If you experience ear pain or pressure changes during flying or diving, use techniques like swallowing, chewing gum, or using earplugs designed to equalize pressure. If you work in a noisy environment, wear appropriate ear protection. The prognosis for tympanic membrane perforations is generally good. Most small perforations heal spontaneously with proper care. Even larger perforations that require surgical repair have a high success rate. With treatment, most people regain their hearing and experience relief from other symptoms. Recent research focuses on developing less invasive surgical techniques and exploring the use of biomaterials to promote eardrum regeneration. Scientists are also investigating new strategies for preventing ear infections, which could ultimately reduce the incidence of perforations.